Hi everyone, and welcome to our very last lecture for microbiology for the surgical technologist. So we made it, we have arrived, and this lecture is going to be wrapping up our discussion of microbiology with emerging, reoccurring, and reappearing diseases. I think that it's blatantly apparent that disease is not going to go away, especially infectious diseases. And as we know, because we're living it today, right? But even before COVID, we're always hearing about some outbreak of some sort of infectious disease. And the book talks about how in 2014, there was the largest outbreak of Ebola virus that Africa had ever seen since the 1970s. And I pulled this information off from the CDC's website, specifically about Arizona and COVID cases. And this indicates that the number of cases here in Arizona is 152,000 and some change, almost 153,000, which is substantial when we look at the other states, like we're the new hotspot. Number of deaths are totaling over 3,000 with more than 1 million tests. New cases reported as of today, 2,335. New deaths reported today, 89 in Arizona. 89 people died today due to COVID. Number of new tests, almost 11,000. Rate of cases per 100,000. 2.127. Rate of fatalities per 100,000, 42.61. Total percent positive, 12.5. 12.5. So we are living during one of the largest outbreaks. So they're going to have to update their textbooks. One emerging viral disease is viral hemorrhagic fever, and there are 4 different types that the book talks about. And the first one is Ebola. And one of the reasons that these viruses are so effective is because they can mutate really quickly and adapt to their changing environments. And we've already talked about how the faster a virus replicates, the higher the chance there is to be some sort of mutation, which can be something that's beneficial to the virus and allow it to evade whatever treatments that we have developed. As far as Ebola goes, replication of Ebola within the host cell is very fast, and this allows it to spread quickly into the bloodstream and travel to other organs where it can cause tissue death. There are lesions that appear on the vessels, on the insides of the vessels and on the platelets, and it destroys those structures. It leads to uncontrolled bleeding of the mucosa, abdomen, and pericardium. This leads to depletion of blood volume, which then leads to shock, which then leads to respiratory failure, which then can lead to death. Ebola was named after a river in the Congo, formerly called Zaire, and it is a zoonotic disease, so that means we get it from animals, and for a long time they're still not 100% sure which animal or which host we get it from, but they have isolated it in some fruit bats. Person-to-person contact is how it is transmitted, and caregivers of those that have Ebola are at a really high risk of becoming infected. Next on our list is Marburg hemorrhagic fever. It was first recognized in 1967, and there was this research. There were 2 laboratories, one in Germany and one in Serbia, and these lab workers had been monkeying around with, no pun intended, African green monkeys and their tissues. And so 31 individuals became ill, and then family members and medical personnel of those individuals became ill as well, resulting in 7 deaths, and they have identified a fruit bat as the natural reservoir for Marburg virus. The bats don't show any signs, but they can transmit it to other animals or primates and humans. And the outbreaks of it are pretty rare. Dengue fever was first identified in 1770 in Africa, Asia, and North America. The CDC estimates that more than 400 million people are affected every year, and it's caused by 4 serotypes, dengue 1, 2, 3, and 4. They suspect that this is transmitted by a mosquito, and then the sickness lasts for 2 to 12 days, and symptoms include break-bone fever, which is very painful, pain in the joints, pain in the muscles, high fever, headache, and rash. Can also lead to leukopenia or thrombocytopenia, loss of appetite, abdominal pain, vomiting, and hypotension. Hypovolemic shock can also occur because the plasma starts to leak through the vessel walls. And there is a 50% mortality rate with all cases of dengue fever. Dengue fever. And then loss of fever. Loss of fever is was first identified or described in 1950s, was isolated in 1969. There were 2 missionary nurses that were in Nigeria, and they contracted the virus, and then they died. And it is endemic to areas like Africa. And in 2014, there was a case. A traveler returning from West Africa to Minnesota was found to have Lassa fever, and the CDC indicates that that's the 7th known case in the United States. And they suspect that this is transmitted via rodents, and the rodents shed the virus in their urine and their feces. That dries, that goes into the air. If an individual inhales it or ingests it, then they can get the Lassa fever, and it's highly contagious, transmitted from person to person at that point. Signs and symptoms including fever, fatigue, GI issues, respiratory issues, cardiovascular issues, neurologic issues, pretty much every system being affected by the Lassa fever. We'll wrap up emerging viral diseases here with a discussion on hantavirus, the chikungunya virus, and then some other random viral infections. Now the hantavirus, that's caused by this cute little mouse. How could it ever carry any type of diseases? It is so adorable. However, this little mouse, field mouse, is the most common vector for the hantavirus. There are 2 different types of hantaviruses. These are RNA viruses, and one is called hantavirus pulmonary syndrome, HPS, and the other is hemorrhagic fever with renal syndrome, HFRS. And the HPS causing virus is also referred to as Sin-Nombre virus, and or the Four Corners virus because of where it was first identified in the United States. The hantavirus was named for the Hantan River in Korea, where it was first isolated from the field mouse in 1976. It's estimated that in China, 100,000 people contract the HFRS type of hantavirus annually because of exposure to the Asian striped field mouse. Typically, individuals with the HFRS type of hantavirus include fever, myalgia, petechiae, GI hemorrhage, pulmonary edema, and acute renal failure, and that can lead to death due to shock from loss of blood volume. In 1993, there were several members of the Navajo Nation in New Mexico that died from some sort of mysterious virus, and they named it Unexplained Adult Respiratory Distress Syndrome, or UARDS. Later, they noticed that there were traps in the homes of these victims of this UARDS and thought that it might have been caused by a new strain of hantavirus. This virus is again shed in the feces and urine of this cute little darling field mouse, and then it can get into the air and it can be inhaled and or it could be ingested, I suppose. Most incidences occur in rural areas. Characteristics are flu-like, but it can result in circulatory system and respiratory distress, and 2/3 of individuals that get this form typically die. Chikungunya virus has symptoms similar to the dengue virus, and in 2013, it was first identified in the Caribbean and Puerto Rico and in the Virgin Islands. No primary infections have been identified in the United States. Typically, it's those individuals that go to these places for vacation and they come home and they're infected with it. And the mosquito is to blame for the transmission of the chikungunya virus. And then there are some other random viruses like the bourbon virus that was identified and named for the county where they found it in Kansas. They're not quite sure what that's about, but they think a tick or insect might have been the culprit for that. In addition, some other rare and random emerging viral diseases include Middle East Respiratory Syndrome and enterovirus EV D68. We used to refer to healthcare-associated infections as nosocomial infections, and so if you're old like me, you might still refer to it as nosocomial infection. And these HAIs are, for the most part, preventable. And that's why the Joint Commission and Centers for Medicare and Medicaid Services and these other organizations are really focused on identifying initiatives that we can use to reduce these healthcare associated infections and ultimately hold those individuals responsible and accountable, right, for managing infections. And I know that Medicare and Medicaid will no longer pay the hospital if they have identified that the infection is because of a surgical site infection or a breach in technique or something of that sort. Medicare is no longer paying for that. And that's a double-edged sword right there that we're not going to get into, but these organizations have been focusing on areas such as central line associated infections, catheter-associated urinary tract infections, surgical site infections, of course, and ventilator-associated pneumonia, VAP. So what we need to do as healthcare providers is limit risk. And some of the issues to be considered are the increasing variety of pathogens they're increasing virulence and they're increasing resistance to medications that we have to treat them, right? Also, non-compliance with infection control practices. We need to follow evidence-based practices to the mark. And if we're not, we're increasing our patients' risk of getting some sort of healthcare associated infection. Hand washing, wearing the proper PPE, knowing sterile technique, knowing how to take off our soiled PPE, all of those things that we've been talking about. Failure to train. You know, it seems like every area of healthcare is short-staffed. And so when they get a new person, they just kind of, toss them in, and there's not a lot of training. And also, you need to retrain. It's not just the new people that need to be trained. It is your, the people that have been there for a while. That's why we have continuing education. And, I think that also means educating the community as well on what they can do to limit the risks of them developing some sort of healthcare associated infection. Insufficient PPE, man, have we seen that with the coronavirus, right? I used to be able to buy a box of 50 masks for $5. Now they're $50. There aren't masks, there aren't gowns, HEPA masks, those gloves, all of those things, we're having a super difficult time getting a hold of those, and clinical sites are asking that students bring their own PPE to their clinicals. And so this is a serious concern, the lack of PPE. Also, complexity of devices. And I think we talked about before about how there was an outbreak because these flexible scopes that the hospital was using were not being cleaned properly. And there was a situation with the VA not too long ago about that. And one of the problems is that these devices are so complex that makes them really difficult for us to clean them and clean them properly and efficiently. It takes forever. And if you're skipping a step, or the technician that's cleaning it is skipping a step, they could be contributing to the HAIs. The CDC has come up with a list of pathogenic bacteria and viruses that they have identified that are most commonly responsible for the majority of healthcare-associated infections, and some of those include the Acinetobacter, Burkholderia, Clostridium, Carbapenem-resistant Enterobacteriaceae, gram-negative bacteria, hepatitis virus, HIV, influenza virus, Klebsiella, and MRSA, in addition to Mycobacterium, norovirus, Pseudomonas, Staphylococcus, Mycobacterium tuberculosis, and some vancomycin-resistant bacteria such as Staph aureus and Enterococci. These are all listed on page 335 and 336. We've been talking about antibiotic-resistant microorganisms, and the CDC estimates that there are 2 million infections from antibiotic-resistant bacteria occurring annually that are resulting in approximately 23,000 deaths a year. And, this is a vicious cycle. So there's two situations I think going on here. One has to do with the antibiotics that we feed the animals that become food that we eat. And then the other is over-prescribing of antibiotics. And so this develops resistance on both sides. So if animals are getting antibiotics, they're developing resistance. We eat that food, and if we don't cook it correctly, we get that resistant bacteria passed on to us. And then if it's stemming from the other side of the coin with over prescribing of antibiotics, then in our bodies we're developing resistance, and or when we get feeling better, we stop taking our course of antibiotics, and this results in a mutant strain, right? Or an adaptive strain. And then this is just a vicious cycle that continues on and on. Two common types of reoccurring diseases related to the gastrointestinal viruses are norovirus and rotavirus. Outbreaks of norovirus have been found on cruise ships, schools, nursing homes. These are areas where people are kind of in really close contact with one another. Also, foodborne infections are a source. The disease is extremely contagious, and one of the ways that we do best to prevent it is by washing our hands, washing food, making sure that we, when we're preparing it, we are paying close attention to hygiene and making sure we disinfect and decontaminate all surfaces. There are two types of oral vaccines for the prevention of rotavirus, but there is no vaccine available for the prevention of norovirus. Some scientists are working with antibiotic therapy, and even though antibiotics do not kill viruses, they do, some of them, right, are bacteriophages, and so that means they have a symbiotic relationship with bacteria. So essentially, if we can eliminate the bacteria that they use as hosts, maybe we can eliminate these viruses or greatly reduce them, but they are still studying that type of therapy at this point. Foodborne infections. Reoccurring foodborne infections can occur in a variety of different types of foods, and typically the culprits are E. coli, Salmonella, Listeria, Cyclospora, and Vibrio. The book talks about the years between 2013 and 2015. There have been several outbreaks with Listeria and Salmonella and E. coli. These bacteria have been found in ice cream, frozen, raw, stuffed, and breaded chicken products, frozen tuna, also different types of vegetables like cucumbers and bean sprouts, cashews, mung beans, different types of cheeses, and other meats such as chicken and ground beef. No discussion about reoccurring diseases would be complete without a discussion on HIV, or the human immunodeficiency virus. It continues to be a serious threat and listed as a reoccurring disease. HIV is transmitted through contact with blood and through sexual contact, like semen and vaginal secretions. But there are a lot of misnomers out there about HIV/AIDS, and I can remember, oh gosh, this was probably 1995, 1996, and I was in college and I worked on a project regarding HIV/AIDS awareness campaign for one class I was in, and I surveyed college students to determine their level of understanding, and this definitely was my finding too, that a lot of people think that you can get HIV from kissing or shaking hands or through tears or sweat, saliva, but you can't. It is not transmitted through mosquitoes, ticks, water, air. You can't get it by drinking after someone that has HIV. It does not live outside of the body very long at all. People used to think that you could get it from sitting on a toilet seat. You cannot. So awareness and education is just a common thread through all of these reoccurring diseases and emerging diseases. Really, the only way we can get HIV is through needle sticks, right? So healthcare workers that are at a high risk for that. And the worst one is hypodermic needles. That's like the most scariest one for me. But it could also be the Gelpie or a skin hook or a SIN, right? Like we don't want to be poked or stuck with anything from anyone. And we just want to use our standard precautions. Just go out there pretending like everybody has HIV and that you don't want to get it, and just, work accordingly. Statistically, 1.2 million new cases. 2.1, I think I have dyslexia. 2.1 million new cases of HIV in 2013, and an estimated 35 million people living with HIV worldwide. 14% of individuals do not know they are infected. That's 1 in 7. Okay, so just looking at the chart to see what somebody has is not enough to protect us. We just have to assume that everybody has something that we don't want to get. Then we have our reappearing diseases, and two that there's kind of a buzz about is measles and whooping cough, right, or pertussis. And this is really sad, and it's 100% preventable because we have vaccinations for these. And the CDC at one point indicated that measles was eradicated and whooping cough has been eradicated. However, parents are not getting their children vaccinated according to public health recommendations. And so these guys are making a comeback, unfortunately. And then the other thing is that we have global travel. We are a global world now. You can travel across the world, and because of that, because of the fact that we are more mobile, that is also contributing to reappearing diseases and emerging diseases and mutated strains, all of those things, because we have the ability to move about the world fairly easily. Some interesting facts that the book puts out is 1 in 1,000 will develop serious meningitis or encephalitis from measles, and 1 or 2 per 1,000 will die from measles, even with medical treatment. And you can see here this world immunization coverage for 2013. Only 84% of peeps are getting vaccinated for Tdap, 84% for polio, 84% for measles, 81% for Hep B, 25% for pneumococcal, and 14% for rotavirus. So, that leaves the gate wide open for these diseases that have been eradicated to come back and to reappear. So this concludes our lecture regarding emerging diseases and reoccurring diseases. It also marks the end of our lectures altogether in this class. And in the words of Ernest Hemingway, it is good to have an end to journey toward, but it is the journey that matters in the end. And I just want to say how delightful it has been to take this journey with you through the world of microbiology. So thank you.